that could ever happen happens. The coronavirus hits Malaysia. Malaysia was in some serious trouble. But don't you ever underestimate the power of Malaysians.
Assalamualaikum and good day. In this presentation, we would like to present on our findings from our research, the topic of level of awareness of wearing masks in preventing the spread of COVID-19. In December 2019, there was a cluster of pneumonia cases in China. Investigation found that it was caused by previously unknown virus, now named the 2019 novel coronavirus. In March 2020, deeply concerned by both the alarming levels of spread and severity and by the alarming levels of inaction, the World Health Organization (WHO) made the assessment that COVID-19 can be characterized as a pandemic. There are different types of coronavirus that cause respiratory and sometimes gastrointestinal symptoms. The symptoms can be ranged from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there has been pneumonia, kidney failure, and even death. In general, the COVID-19 are usually transmitted through droplets, either cough or sneeze, or being in contact with things contaminated with the virus. People most at risk of the infection from the novel coronavirus are those who are caring for the people infected, such as family members or healthcare workers. Malaysian government has taken actions by drafting the Standard Operating Procedure (SOP) to prevent and slow down the transmission of the virus in this country. One of the enforcements done by the government is obliging the wear of masks at public spaces. Wearing masks is one of the steps of non-pharmaceutical action, such as highly effective drugs and vaccines that could be easily enforced at a minimal cost and without affecting social activities significantly. The scope of respondents for this study is working adults. A sample of 265 respondents was selected for the survey. The selection was made based on different range of age among working adults. And the objective of this study is to study the level of awareness of wearing masks among working adults. The study was carried out for 2 weeks. 265 respondents from various social and working backgrounds were selected randomly. We have distributed one set of questionnaire which consists of 5 questions to the respondents.
For the literature review section, we have gathered a total of 5 research articles published in 2020, which are a public health and market study for the potential of mask use for COVID-19. Second, mask or no mask for COVID-19. Third, face mask to prevent person-to-person transmission of SARS-CoV-2 and COVID-19, a systemic review and meta-analysis. Fourth, community use of face mask and COVID-19, evidence from a natural experiment of state mandate in the US. Lastly, impact of wearing masks, hand hygiene, and social distancing on influenza, enterovirus, and all-cause pneumonia during coronavirus pandemic. Recapping all the research articles, there are 5 main points from the literature review. First, there are many debates on the effectiveness of wearing masks, as there are still no clinical studies to prove the effectiveness of wearing masks. Second, the usage of N95 masks rather than a regular cotton mask is found to have greater protection degree. Third, the study over the mask mandate in the US as a complementary evidence to support the usage of face masks has successfully proven the benefits of face masks. Fourth, Taiwan's government policies has been implemented for wearing masks and practicing hand hygiene in mitigating COVID-19. It is also a success in addressing the disease. Lastly, all studies show the reduction in COVID-19 transmission when face masks are worn. Therefore, from all the articles mentioned, wearing masks is a non-pharmaceutical intervention and it really helps in prevention of COVID-19. And this is supported by the evidence study. Of course, this is also to be practiced along with proper self-hygiene and social distancing and other relevant SOP mandated by the government.
This is the data collection and analysis part where the result will be analyzed to study the level of awareness in wearing masks among working adults. Before we move on, let's take a look at the demographic profile of our respondents. We managed to get a total of 265 respondents altogether, ranging from 20 to 60 years old, and most of our respondents are young working adults. As you can see, 87.2% are from the age of 20 to 30 years old, and the least range of respondents' age is 50 to 60 years old, which is only 2.6%. This is the second question in our survey questionnaire. This question was asked to identify the respondents' belief in wearing masks to reduce the spread of COVID-19. Result shows that 97.7% of them agree with this statement. Meanwhile, 2.3% are still not sure whether wearing masks could help reduce the spread of COVID-19. Respondents who believe that wearing masks help reduce the spread of COVID-19 will be most likely to wear the mask as they know it will help protect them from getting infected. The good news is that none of them disagree with this statement. This shows that respondents are aware of the importance of wearing masks in our current situation. The next question is on what type of mask do they use. Out of 5 types of masks that we have listed, only 4 types are selected. None of our respondents used masks with built-in valve or vent. Disposable surgical mask is the most used, followed by cloth masks with filter, which is 9%. Both cloth masks without filter and N95 masks are 3% each. According to this research article, N95 mask has larger degree of protection from viral infection compared to disposable surgical masks and reusable cloth masks. However, World Health Organization (WHO) says that cloth masks are adequate for the use of the general public who are healthy, has no symptoms, and are below the age of 60 years old.
The fourth question that was asked in the survey was about the current government policy on wearing masks in few places, such as outside of the house, in vehicles such as public transport or ride-sharing services, outdoor public places, and indoor public places. The question is based on 4 indicators, which are compulsory to wear masks, advised but not optional to wear masks, non-government policy to wear masks, and do not know whether need to wear mask or not in few stated places. The result for the awareness of current government policy on wearing masks outside of the house shows that almost 80% of the respondents shows that or agree that it is important or compulsory to wear masks outside of the house. This clearly shows that the respondents have high level of awareness of wearing masks outside of the house. As for the policy of wearing masks in public transport or ride-sharing services such as Grab, majority of the respondents have agreed that it is compulsory to wear masks at public transport or ride-sharing services. Remember, if you caught disobeying this law, you may get fined about 1,000 ringgit Malaysia. Based on the finding from the bar chart obtained, although most of the respondents agreed that it is compulsory to wear masks at all indoor spaces or in conditions where physical distancing is difficult, few respondents are still a lack of awareness of wearing masks at indoor spaces. The result obtained for the level of awareness of wearing masks at outdoor public spaces are almost similar to the result obtained for the level of awareness of wearing masks at indoor public spaces. The zero respondent obtained for the indicator did not know shows that the people do have knowledge about the government policy on wearing masks, but the lack of understanding about the government policy of wearing masks. As for the last question for the survey, the respondents were asked to share their opinions on how to increase the awareness among public. A lot of opinions were shared, but I will share with you 3 opinions that caught my eye. The first opinion is to advertise the importance of wearing mask during the television commercial break. The second opinion is the influencers should encourage people to wear mask and to follow SOP. The third and last opinion is to share the documentaries of COVID-19 survivors.
Conclusions that can be made based on the findings are: Number 1. Wearing masks helps to prevent the spread of COVID-19. Wearing masks is extremely needed as it is very important to decrease the transmission rate effectively. Not to forget, the type of mask used and also the quality of mask also influence the rate of transmission risk. Number 2. Results of the study indicates that high level of awareness of wearing masks among different age community. High number of respondents in the survey questionnaire acknowledge that they are aware of the current government policy on wearing masks, by wearing masks for outdoor activities, indoor spaces, and also public transport. The respondents have shared and expressed their smart and worth opinions on improving awareness level of wearing masks in public and can be implemented among the public. Based on the findings and conclusions of the study, there are several recommendations that can and should be considered. Number 1, National Security Council have to publish a complete COVID-19 guidebook. This is regarding the frequently asked question about government policies that has been implemented specifically on wearing mask mandate, as there are still numbers of individuals that are not aware of the current policies. Number 2, Malaysians should wear masks every time they went to public to lower the risk of COVID-19 to be transmitted to them. Number 3, Unical MFI and other NGOs could collaborate to provide the needy with free face masks to ensure that the mandate of wearing face masks is obeyed.